Hi, this is Dr. Bryce Gates with Custom Dental. I wanted to make a quick video just in case you're wondering how to take care of your extraction site. So you just had a tooth removed, maybe you had a bone or an implant placed in there also. A few things that I want you to remember. So the worst thing you can do is swish. If you're doing that, you're causing a lot of turbulence in your mouth that can dislodge that blood clot. So remember, you have blood filling in that area where the tooth used to be, and it's like jello at first, so you don't want to do anything to dislodge that. You also don't want to do anything to melt or break it down. So hot liquids are also a no-no. You can have your coffee, just make sure it's iced, but no hot liquids, no hot soups or anything like that. That's for the first 3 days. You want to just stick to cold in the beginning. It acts like ice packs to keep the swelling down. So cold food for the first day. You can have room temperature food, but no hot stuff. And then also when you're brushing your teeth, brush your teeth like normal and take water in a cup, put it in your mouth, let it roll around, open your mouth, just let it drool out. So no swishing, no spitting, and also remember, no straws. Use a spoon if you're gonna have those milkshakes, which are great. So soft diet for the first day, cold foods for the first day, easing into more normal foods, but keep it kind of soft and nothing hot for the first 3 days. If you have sutures, they will dissolve. If you can avoid sodas, you don't want fizzy drinks with your extraction sites. And also sodas have acid in it, and so do juices. So if you can avoid sodas and juices, your sutures will last longer as well. They won't dissolve as quickly, which is also a good thing. Don't pick your sutures out, let them just dissolve out on their own. If you have any questions, please don't hesitate to give us a call here at the office. We're here to take care of you, and we hope you have a great recovery. Take care, bye.